Welcome back. Let's bring you this particular interview now that we have been promising you. The story now regarding the workers who claim that they have not been paid for 4 months at the West Vaal hospital. Now, that hospital is run by a company called Phodi Clinics, and we are joined in studio by the CEO of the company, that's Dr. Nkaki Matlala, and the hospital's HR director, that's Miss Ndileka Nobaxa, to give us more details on this story. Good morning to you both, gentlemen, and the lady. Before perhaps we go into the detail of what this is about, let's perhaps listen to a soundbite of one of the workers who explains, who captures succinctly what the problems are that they currently face. So let's have a listen to that soundbite first.
We are part of the staff that was sold to this new company, Phodi. So at the beginning, we started working for them for October. Then we started to have problems in February, as you correctly said, that we were last paid there. So we haven't been paid for the last 4 months, although every month we got the pay slips with all the deductions that they purport to make on our behalf, but they are not registered with Sentinel, they are not registered with Pension Fund, they are not even registered with SARS. We are out of medical aid. We were taken off medical aid because of non-employer contributions. So we are left in a limbo now as we speak, and it has been for the last 4 months.
All right, let's perhaps begin with two pay slips, and I'm going to start with you, Ms. Nobaxa. Two pay slips that have been given to us by one of the employees outside that hospital. It's a pay slip of the month of April and the month of March. Let's have a look at those pay slips. They should be up at any moment on the screen. Have you been deducting monies from employees, in particular for these months in question, April and March, and given that in February, that's when the problems started? I'm sure you can see that payslip. It's on the screen right now. These are, if you see there, those are the deductions that you see the company deducting. Has the company been making these deductions?
Good morning, Polly, and good morning to the viewers. Yes, we have been making those deductions, but it's important to note that these are book entries. And we need to go back to where the problem starts, or where it started.
These are book entries.
Book
what
entries,
does it mean?
Yes. It means that when the time comes for us to pay the employees, when the funds are available, we're going to be able to reconcile all those, pay the necessary, third-party payments, and also the employees.
But, Ms. Nobaxa, if you look at the next page, there is a page that might not be clear in your eye right now, but this is another pay slip, and I think the team will have to move a bit quicker to take us to, it's an income tax certificate of one of the employees at SARS. That is exactly, well, that's not the page we're looking at. That particular page details that against all these deductions that you are seeing being made, it has zeros. It's simply zeros, which means that these monies are not registering on SARS's systems. Is this company registered with SARS? Perhaps let's start there.
Yes, we are registered. We registered in March. Initially, when we took over, we had a partnership with JMCA, which Dr. Matlala will speak to. And they were responsible for all the payments and the registration. Now, when the deal fell through, we then took over and we registered with SARS in March 2019.
If SARS comes back and says you're not registered with them, and that is why they are unable to reflect on their database the existence of this company,
they will not come back. I have proof thereof.
Mm-hmm. Dr. Matlala, you're the man in charge of this hospital. The workers are saying that these deductions are being made fraudulently because, first of all, they're not receiving salaries from you, but secondly, these deductions are not reflecting on the systems at SARS.
Yes, maybe to give a little background, thank you, Chloe, and to your viewers, greetings. As polyclinics, we were approached in around July last year by a company called JM Capital Africa. JM Capital Africa told us that there is a hospital, West Vaal, that is being sold by Anglo Gold. They were approaching us because we were a hospital management company with experience, and we agreed to form a joint venture with them where our role was going to be management of the hospital. Their role was going to be financing of the hospital. We signed a sale agreement with Anglo Gold Ashanti around September, wherein we as a hospital management company guaranteed the clinical management of the hospital, the continuation of the hospital services. We did not guarantee the financial aspects of the hospital. We began operating the hospital on the 12th of October 2018, and the transfer was smooth. The hospital continued working. However, when the financial contributor, the finance company, was supposed to contribute the finances, they reneged. They could not. Immediately after we took over, the end of that month, October, we were supposed to pay salaries. They were nowhere to be found in terms of paying the salaries. Then we realized we had problems. I, as a CEO of a company that has guaranteed clinical continuation of the hospital, had to make means to make sure that I scrape wherever I can to continue paying salaries for employees.
When last did you pay salaries to employees?
The last time we paid salaries was March. Yes.
End of February.
End of February, yes. Because we then embarked on fundraising when we realized that we were now left in a lurch by this company that had promised that it is going to fund every process of the hospital. So, yeah.
All right, let me bring into this conversation all right, I'm told that the Northwest official from the Labour Department in the Northwest has yet to join us, but we will be joined by them to confirm whether indeed the company is registered. From what you know, Ms. Nobaxa, is this company in the books of the Northwest Labour Department? Is it known to them?
Remember, when we register for pay-as-we-earn, skills development levy, and UIF, you do it within the SARS department. You get all the documentation from SARS. We registered in Centurion. We've got that documentation. I have it with me.
All right.
I think the problem is the fact that funds have not been transferred. And the reason for the funds not have been transferred is because there is no funding at the moment. We have no finance, capital finance for operations.
When you say these deductions that are being made, first of all, you call them book entries. If we, for example, use the pensions contributions as an example, what company are you working with that these monies are going into, the pensions contributions?
We are working with Sentinel, but we have not paid money into Sentinel. I think we last paid in January. The reason being that we do not have finance to actually do that.
Mr. Matlala,
yes,
are you running a fraudulent scheme here?
Never. I would never.
So how do you plan to resolve this situation? Because the union in the Northwest, the NUM, is calling you a fly-by-night because you clearly are defrauding workers. Where do you expect workers to get monies now?
Thank you. Polyclinics is not a fly-by-night company. It's a company that manages 2 other hospitals. We are, and we have experience in doing that. We are just not a financial company. That's why we could not have gotten into this had we not been with a partner who promised to be able to finance the whole project. Now, why did we remain when they left? It is because we had a belief that going into the financial industry, we will be able to raise funding, because in the coast region, we think that this hospital...
You went into this based on a belief, Mr.
No, not a belief, an agreement. We had a joint venture with this capital company. But by the time they left, remember, we had an agreement that we were going to manage this hospital. So we had a management agreement that, you know, the clinical services will continue in this hospital. So we wanted to make sure that clinical services continue. That's why we injected 8 million of our own money from the time we took over, when they could not perform, we had to run around and raise that money to run.
You have a crisis, though.
We have a big crisis.
You have not.
I understand. We have a big crisis. I spend and the staff spends sleepless nights because it's a problem. You know, when families don't have food, when families don't have money for transport, when they cannot pay fees for their children, it's painful for all of us. And, especially for myself, who is heading this company. And that is why I've knocked at all doors to try and get funding to sustain this hospital. And I believe that we will do it.
Let me ask both of you this question. How are you getting by? Where do you get your monies at the end of the month?
Sometimes we go without money. I have an old pension that I get, and I survive on that. And I don't get a salary. She also doesn't get. At our head office, you know, we do get a little bit of management fee from some of the hospitals that we're managing.
Let's let you answer for yourself, Ms. Nobaxa. Where do you get your money at the end of the month?
Well, I get it from my family. I have not been paid as well. You know, employees at the hospital were paid from October. We have not been paid. In December, we paid them bonuses after working for a month, a period of 1 month, which was in October, half of October and November. They got a prorated bonus, which we did not get.
Do you have a solution at hand, Mr. Matlala?
Yes, Koli. I'm fighting hard to get a solution. I'm talking to 3 funding companies that I have indicated that they would like to participate in this. We have sent those letters to Anglo Gold, who are the sellers of the hospital. But let me continue to say to you that the reason we're having these problems is because West Vaal Hospital was a mining hospital, was a cost center for Anglo Gold Ashanti. As a mine, every year they had a budget that they pumped into the hospital. The hospital did not have to make any money. It's a well-equipped hospital. It's a good hospital for that community, and that is why we are still in there fighting that we now make it a hospital for the community, because we know that the needs for hospital are very high in that region. So I can talk about that, but at this stage, we have not yet finalized any funding for that hospital.
Yet the
but
hospital remains operational.
At a very low level. When we took over the hospital, there were only 2 chronic patients lying in the hospital. At this stage, we have not admitted any patients. We cannot compromise. We cannot compromise patients.
So it's fair to say the hospital right now is not functional.
It's only outpatients. There are doctors who see patients in outpatients. That's about it. There's no hospital, no theater work is going on, no deliveries are going on. It's basically there is you get into those wards, there are no patients on the beds.
Okay.
Yes.
Mr. Matlala, final question. Are you aware of what is likely to happen to your license? Is the Department of Health perhaps making any moves against the license that you have?
The license that we have is a temporary license that expires at the end of June. We knew that. We were and are still expecting the department to extend the license. What happens is that every year, then once you are operational, every year the department comes, makes an inspection, and they renew your license. So it is possible that because of these problems, not because of clinical problems, the license might be withdrawn, but we plan to meet the department in the next week.
Critically important then,
yes.
Once the license is withdrawn, if it does get withdrawn,
yes,
it means you out of that particular hospital's premises. Where do workers find you in order to get their monies for the last couple of months?
We have always been transparent. The workers know where we are. Let me. I hear your question, but let me. Yeah, yes. I'm a South African. I mean, all my life is here. The company is here. The workers know where to find us. That's why in Pretoria. Yes.
Pretoria.
Yes.
That's where you're based.
Yes, that's where we're
headquartered.
Based. Yes.
All right. Thank you very much. That's Mr. Nkaki Matlala, He runs Phodi Clinics, and alongside the HR Director, Ndileka Nobaxa. Thank you very much for making the time to speak to us, to both of you.